So today we have Paloma and Tigger here, and they're going to have an exam, a physical exam, and vaccination as well. So we are doing a low-stress procedure for them. So this is a fear-free way of doing things. So the way we want to set up our environment is we like to do everything on the floor because the table can be scary for a lot of animals, including kittens. And we want to have the floor set up with all the things that are positive for them, including associate the things that we're going to use during the exam, like stethoscopes, nail trimmers, things for procedures that may be perceived as scary, but we want them to make a positive association with all of these things here. So we want to have some treats available for them and scatter some around the floor and have some things that they can eat during the procedure, during the vaccine. For example, we like to use lick mats to set them up for the vaccine so they're distracted with the food that they like and then they don't really notice what we are doing. So we want to have everything that we need kind of already prepared in advance and have the vaccines already pulled and all ready to go when it's time to do so. So another thing that we always use in our appointments is pheromones. So for cats, we like to use the Feel Away. So we spray the rug with Feel Away in advance, or towels, anything that we're gonna use here that is fabric. And even their carriers, when where they come in or before they go home, they go with a Feel Away spray. So pheromone is something that we always wanna have in the environment where we're doing these procedures with them. So we're gonna start with the physical exam, and for that, we don't want them to think that they're being examined at a vet. We want this to be like a play session for them. So we're gonna get them over here and then start interacting with them. So we don't have to start the physical exam always the same way, so we can check lymph nodes first, check their abdomen, and if the history tells us that they're doing well, no vomiting, no diarrhea, they have a soft abdomen, then we don't really necessarily have to take temperature. So temperature is optional. If you have a sick pet that justifies that type of information, then we definitely want to do that. But if they're not sick, they're feeling well, and it's just a regular vaccine appointment, they don't have to have that part done, at least not today. So we can do the exam in parts like that, do a little bit, and then let them go. What we don't want to do is like hold the cat for too long or scruff them. We never do scruffing for any animals. There is no need to do that. So we want to make sure that they're entertained with something like a treat like that, for example, while we are doing things that they don't even notice that we are actually doing an exam on them. So we can auscultate them and kind of partially restrain them like that, just put our hands around, but we don't really need to hold them for too long or scruff or pin them down or anything like that. So kitten exams are much easier because they're easy to distract and they're very naive to all that's going on here. They don't have like negative past experiences, so they're learning the positive way from the beginning, and that's the point of doing it this way right now, so that later when they grow up, they don't learn to hate this experience or to hate the vet visit, right? So we want this to be all very positive. And we're going to stop offering it for just a sec. And go again. So we want them to think that this is just, a fun play opportunity versus think that they're being examined or something bad is going to happen to them. Very good. So we're going to get some of the food there. There we go. Oops. If you bring it up a little bit for me. There we go. Very good. Awesome. Very good. Good job. All right, so we're going to get ready for their vaccines. So when we give vaccines, you know, we pull them out of the vial in advance, but what we always do, no matter what size the patient is, it could be a 65-pound pit bull or, you know, a 3-pound cat. It doesn't matter. We always change the needle to the smallest needle that we can have. Normally that's the 25. So it doesn't matter because pain is perceived the same way. If you are a big person or a small person, it doesn't matter. The perception of pain is always the same. So I always have a 25 in my pocket and I change that needle right before I have to give the injection. So for vaccines, or any procedure, we like to use distractions like lick mats. So we put something yummy on it, like the churro or any baby food, whatever the animal likes. We like to have that spread before and then offer it to them right before we have to give the injection. Tigger, do you want some of this? And the site where we're gonna give the vaccine, we also like to scratch it first to kind of desensitize that area a little bit before we actually do the poke. And they do feel the poke like that. So sometimes, you know, of course they notice that something happened and they jump a little bit, but they don't actually react to the procedure because they're a lot more interested in what's going on down there with the food and the treats than worried about what's going on here. So this is how we want them to perceive this procedure. So sometimes we massage a little bit, but it should be that easy every time. There we go. So she's going to scratch her leg before giving the vaccine. That was it. She felt it a little bit, but she didn't really walk away or react or anything. And she continues to lick the food here and not worry about what was going on. I don't think they realized they were at a vet's appointment and it was vaccination day today. So it should be fear-free or, you know, low stress handling to the best that we can to promote the well-being of the pet. Good job, kitties. Was it easy? Yes? In the first appointment, we also like to discuss with the clients, you know, problem prevention. So we normally ask what's going on in the home, if they're having any issues with litter boxes or types of litter. We also like to introduce clicker training to them, and they go home with a clicker to practice at home. Target training is one of the exercises or training exercises that cats normally like, and it's very easy to teach them because they're curious animals. So what we do is we like to offer them a target. As soon as they make contact with that, we click, and then we offer them a reward so that they learn that touching this means food is coming. So it's very easy. Cats are very curious, and they like to touch things and investigate. So target training is the best thing that we can teach them in order to, you know, prep them for the things we want to teach them in the future using clicker training. So there's no limits to what cats can learn with clicker training. And that was Tigger. Paloma, do you want to do some of this? No, there's still food here. Paloma, good job. We also like to teach clients to start training them for nail trim procedures. So what we like to do is position the cat and give them food while the other person is holding their paw. So we're not going to actually trim their nails today, but actually we can. It's already happening. So
that would be great.
It's much easier to do the procedure this way with them eating something and being occupied with something more productive and something that they like, while the nails are being trimmed like that. Very good. Good job. Who's next? So instead of scruffing them or holding them, you know, in a way that makes them uncomfortable and fearful, we like to do procedures this way. So it's a good way to start training them for everything vet-related so that they never learn to fear these procedures at home or in the veterinary setting. So we like to end our appointments with some free food for them. So now they don't have to work or stand still or let us trim nails. We just let them munch on the food. And that's it. Today was a happy vet visit day. So for more information on how to get an appointment for your cat or your puppy with our service, just visit our website and then you can call us and we can schedule that for you at your earliest convenience. Thank you.